Okay, and the talus, you can have what's called a trimalleolar fracture, where someone cracks off both of their malleoli and the trochlea of their talus, and it requires a screw, at least into the talus, but sometimes into the malleoli as well. So that's one reason why we palpate the talus in so many places. We're also going to use the talus to tell us when the foot is in a neutral position, so we need to be able to palpate a number of structures on the talus for that reason as well. It also is going to have a lot of articulations with some pretty key ligaments in the area. So that's why the talus is getting so much face time with us. Here, I'm going to outrank you. Sorry-ish. So now we're going to palpate the medial structures of the ankle. So here, if we come anterior to the medial malleolus, now we're going to be on the neck of the talus. And we are going to, when we put Ifeanyi in prone in a little bit, we're going to actually have our hands in both places on that talus to see how it's positioned in the talocrural joint to determine for the subtalar joint, so that we can figure out subtalar neutral. Okay, so that's why we need to be able to palpate the talus in these two locations. Now, the medial tubercle of the talus, we're actually going to come down one finger from inferior and posterior, and there's going to be a small bump on the talus, and that's going to be the medial tubercle of the talus, and that's going to be part of the attachment of the deltoid ligament. So the deltoid ligament is going to be a triangle. Shouldn't be too much of a surprise given its name. And it's going to attach somewhat like this. So to palpate the deltoid ligament, again, we're going to go cross fiber. You're not going to be able to feel if there's integrity or not of this ligament. So again, we're looking for reproduction of symptoms. Usually the location of the swelling and ecchymosis, so the bruising, will tell you if it's a medial sprain or lateral sprain. Also, the word sprain means that a ligament was affected. Strain, S-T-R, means that a muscle was affected. So when we're talking about these ligaments, the medial and lateral ligaments, it would be a sprain, S-P-R. Okay. Tubercle of the navicular. So we have not talked about the navicular or the calcaneus a whole lot. The navicular is going to be the highest point of the arch of your foot, and there's going to be a fairly big tubercle there. This can be used to measure how flat someone's arch is. You can actually measure the distance from the most inferior aspect of the navicular down to the ground when the person is in weight bearing. It's also the attachment of the spring ligament, which goes from the navicular tubercle to the sustentaculum tali, which is it is a plate on the calcaneus. I'm going to get Sam.
That was on the
What was it called? Oh, that's one where I asked someone what it was before the exam, and they're like, I have no idea what that means. So I was like, oh, okay.
That's what he said? So if we're looking at the medial aspect of the foot, this is the navicular, okay? So it articulates with the medial cuneiform and the talus, and it's going to have this bump. The sustentaculum tali, you're going to come inferior to the medial malleolus, come down to the bottom of the foot, you're going to push back up, and you see there's this flat portion of the calcaneus. That's going to be the sustentaculum tali. The spring ligament goes between these two structures. Okay, and the spring ligament is fairly critical for maintaining the arch of the foot. Okay, so again, navicular. I'm going to come down and feel the sustentaculum tali, which I did a much better job of this time, which is right here. Okay, so my two fingers are on those structures. To palpate the spring ligament, I'm going to go in between those. Okay, so navicular tubercle, sustentaculum tali, and the spring ligament. Is that everything on that previous slide? Yep. Okay, so go ahead and put the next one up. We'll leave this slide up for you, and you have it in your notes. This shows the anatomical image of all the structures you're palpating on this side, the medial aspect of the foot. Okay, so we've got medial malleolus. We've got neck of the talus. We have the medial tubercle of the talus. Okay, the deltoid ligament, all inferior to the malleolus. we have the navicular tubercle, we have the sustentaculum tali, we have the spring ligament in between those two structures. All right?
Just trying to focus.
You look so tired.
A little bit.
Okay. All right, so let's go ahead and palpate medial structures.
Let's go.